So I've lived with chronic illness for over a decade now. I was first diagnosed with Sjogren's syndrome in my mid-20s. And then in 2021, I got very sick and ended up getting diagnosed with an autoimmune disease called myasthenia gravis with POTS, and I ended up having a stroke as well. And in that experience, it was so difficult to get the right diagnosis, to find doctors who believed me and took me seriously, to try to figure out what was wrong with me and not just think it was only anxiety, to deal with all of my medical records from all of the different places and how do I give that to people and finding the right doctors. And it felt like a full-time job being a patient. So I started Chronius to kind of help myself and other patients, like make it a little bit easier to manage being a patient so that you could focus on just like symptom management and not all the other stuff that comes along with being a patient. And what we're trying to do with these patient interviews is feel like every patient's journey is a little bit different, but when we hear other people's stories, we find ourselves in their stories and it makes us feel a little bit less alone going through this. It has only been for me in the last few years of building this and getting to meet with other patients that I have felt like so much less alone in my experience. When I first was diagnosed, I was very I don't want it to, be who I am. And I pushed away support groups. And I think that was a big mistake for me because I didn't have anyone in my life who had these conditions. So I'm hoping sharing patient stories throughout the journey, which I almost think of as playing Candyland or Chutes and Ladders game, because you move forward and then you land on the wrong step and you end up going backwards or to another place. So we want to visualize that and then share patient stories with that. So does that make sense? Any questions about any of that before we get started talking about your experience?
No, I completely love that. I think that's one of the main reasons that got me to start sharing my journey online was because I felt so isolated at first. And again, yeah, I didn't even tap into any, support groups or consider that as a route at all. I didn't know of anything that existed. I felt like nobody under, 65 even understood what I was going through.
Yeah. I think in my head, because when I was diagnosed with Sjogren's, they're like, oh, the average age for someone with that is postmenopausal women, is 60 plus. And I was like, oh, I'm 25. If I go, and I'm not going to connect with one. It's amazing that almost every patient I've talked to now are folks in their 20s, women in their 20s and 30s. This is happening for young women. And it's almost like you speak a secret language with people who have the conditions because you know exactly what they're talking about when they kind of say their thing. And it's kind of nice to feel like you have someone who gets you. All right. Well, why don't we get started at the beginning? What were the first symptoms that you had that made you think maybe I should see a doctor or get some medical attention? And kind of how long did it take you from when you first started feeling the symptoms to actually going to the doctor?
Okay. So I first started experiencing symptoms. I was on a camping trip when I was 14, and I was out with friends on a hike, and my knees started hurting really bad, and to the point where I didn't feel like I could walk back. And so they gave me a piggyback ride, and we didn't really think that much of it. Figured maybe I sprained my knee or something, and that it would go away with rest. And then it just continued, and it spread. It felt like it spread through my whole body, joint by joint. By the end of the week, I could feel, what felt like every bone in my toes hurting. And I think I suspected fibromyalgia pretty early on because my mother was diagnosed with fibromyalgia 10 years previous to that. So when we saw me starting to develop symptoms, she was like, uh-oh, this might be a problem. So she was a huge advocate for me and initially, getting me into a rheumatologist as soon as possible to, work towards a diagnosis. So I would say it probably, took us a few months to get in, and then all the testing began.
It's almost like having that guide, almost I think it was like a Sherpa kind of thing of if you have someone if you know what to look for, the diagnostic process is so much shorter that, and it's still not short, but then compared to if you don't, like, if you had never heard of fibromyalgia before because your mom didn't have, could
Yeah,
have a
absolutely.
different experience type of thing.
Or it might have been harder for, her to believe what I was going through. But she understood and was immediately concerned. So that was big. Yeah, that was big in me getting my first initial diagnosis.
So talk to me about that first rheumatology appointment because like was there any issues that you had with that doctor in terms of gaslighting, or were they pretty like with you and figuring out like, oh, this might be fibromyalgia, especially because you were, younger, like still a teenager? Did that play a role in kind of how that doctor interacted with you?
Absolutely. I felt like um primarily having my mother there, like I felt like having her support, and having another adult in the room, was huge in order to advocate for me. And I feel like the doctor, was trying to look for something, but didn't, initially jump to fibromyalgia right off the bat. Obviously, they wanted to rule out all the other things that could possibly be causing these symptoms, and as well as, potentially, testing. They were using trigger point testing at the time. And I want to say I had 17 of 18 of the trigger points. And they were able to initially make the diagnosis, but unfortunately, because I was a minor, they said that there was nothing they could do to treat me or help me in any way. So that was pretty frustrating. It felt like, at least like, I had an answer and I had a name for this thing that was going on. So, that was validating. But then it was just really discouraging, feeling like there was nothing that anyone could do for me until I turned 18. So I felt like high school and like, my kind of teenage years were just going to be ripped away from me. I was like, I just want to be a normal teen.
100%. I mean, I have so many questions after hearing that. The first being like, that sounds like that makes no sense, right? Why is like a magic wand all of a sudden you turn 18, you could do something? Did you seek a second opinion for that? Or did you just feel like you had to accept, I'm gonna be in pain and there's nothing we could do about it? For because if you were 14, that's like a long, several years type of thing that you'd have to be struggling with no treatment.
Yeah, it was really difficult. I was really depressed, and I honestly probably didn't get off of our couch or go to school for a couple of months. Um, it was a really rough year just adjusting to that diagnosis. And I guess backing up, initially they told me that it was just juvenile fibromyalgia, that you're only 14, this will go away within 3 years. By the time you're 17, it won't be an issue. Even you're going to grow out of this. It's just a growing pains thing. So that was, kind of the narrative that they were pushing in the first place. But also they were like, we can't give you any, narcotic or opioids as a minor. So therefore, there's nothing, we can do for you, unfortunately. So, yeah, we just kind of felt like that was a dead end.
So did you seek a second opinion on potential treatment, or did you basically like just go through the rest of your teenage years just being in pain?
Really just, yeah, struggled through the next few years. And then the next time I went to a rheumatologist was when I was 18.
And what was that
And
experience like when you went when you were 18?
it was also really difficult. I realized, I was the only one in the waiting room, my anywhere close to my age. I think that was the first initial thing I noticed. And it was a teaching hospital, which all four, obviously. But I wish I'd had some like prior like knowledge of really what that experience was going to be like. Because it felt like I just got poked and prodded and blood drawn, and six different doctors came in the room asking me questions. It was a very overwhelming experience. And they put me on some medications to try. And at first they put me on Lyrica, I had a really, really bad time on that. It made me really sick. I tried it, taking it in the morning, taking it at night, with food, without, and it didn't really matter. And they just kept saying, no, the nausea will go away, don't worry about it. But I was just throwing up every day and I couldn't stop. And so I finally had to take myself off that medication after about a month and a half of just excruciating side effects from that. And then I went back, and they really said that, that was all that they could do for me. That was all that was, approved at that time. And they didn't, feel comfortable giving me anything else either. Um,
That's so hard. I relate to that in a big way, because the first medication they put me on for my Sjogren's, which they said was, like the least amount side effects, the safest, right? I also got really sick from it like every day and lost like 30 pounds in a month and had to go off it. And when you feel like the easiest option is taken away from you as a treatment, and then all that's left is either there's nothing we could do for you or like pretty extreme drugs, that is like a pretty overwhelming feeling. What did you feel like when they were like, there's nothing more? Like, did you feel like accepting of that? Did you feel like I need to try to see if there's anything else I could try? Like, even if it's non-medical, like, what did you feel when they said that to you?
It was really frustrating again. The main reason they weren't willing to try anything else was because of my history of depression. So that ruled out a lot of the other things that they could try to prescribe me. And so, yeah, because of that, it just felt like I really didn't have a lot of options. Um, Unfortunately, yeah, I had to take a lot of my pain management into my own hands. And yeah, was just kind of treated like a medication seeking addict by a lot of the first doctors that I saw in my early 20s. I don't know if that was just because of my age or because of the symptoms that I was experiencing and describing, with invisible illness. But for whatever reason, they were, typically very put off if I would, press further about, needing some kind of pain management to make it through the day.
Yeah. How did your symptoms change, or did they change from when you were first diagnosed at 14 to 18? Because you went 4 years of basically untreated fibromyalgia. Did they change? Did it get worse? Stay the same? Did it have different types of symptoms by the time you went back to the rheumatologist?
Once I finally got off the couch and had, really started battling my depression and getting treated for that, I was able to, start walking more, battling the stiffness I was experiencing, um, generally becoming more active again. And I would say by the time I hit college, I had a pretty good handle on the baseline pain. I felt like I'd become more and more used to that daily pain, but the flares would, still knock me out for days or weeks at a time. Um, that was something that I really struggled with going through college, was the mandatory attendance policies. That was something that I struggled with in high school as well. As a matter of fact, as far as what is it, tardiness. But yeah, I was never good at attendance, that's for sure.
And did anyone at school, because I feel like there's a lot of folks out there that are either experiencing symptoms when they're in high school, college, or they're getting diagnosed for the first time around them. Did anyone, and you already had a diagnosis, did anyone ever talk to you at school about, like accommodations for you because of your condition, to help with things like if you were flaring and you couldn't go to class, like things like that? Was that ever an option given to you?
Yes and no. I would say that that didn't come from the school system, but again, it came from my mom in a doctor's note, going head to head, fighting with them to get me accommodations, which eventually led to, getting me an extra locker, an extra set of books, so I didn't have to carry them back and forth to home since I couldn't carry a book bag anymore. I couldn't do stairs anymore. So I was given a key to the elevator, which again, with an invisible disability, was very misunderstood by a lot of the classmates and even teachers, unfortunately, wondering why I had an elevator key or why I was getting special treatment. So that was, unfortunately, I was singled out and targeted for some bullying because of that. But overall was able to get accommodations in place, but not for attendance.
That is very challenging to feel like you're dealing with all that. And on top of that, being bullied because people can't see what you're feeling on the inside type of thing is really tough. Next one, I mean, any of these questions, don't feel like you have to answer them if you don't feel comfortable, but talking about like mental health is something I think a lot about with invisible illnesses, because I sometimes feel like it's a chicken or an egg kind of situation sometimes, or that two things can be true at the same time. Or
Hi,
I feel
you're so
like
right.
a lot of patients get and I've been there too, of like, your pain is just anxiety, or you're just stressed, or things like that, and it's blamed on mental health. I think a lot of folks with chronic illness can also struggle with their mental health, like with depression or anxiety, because and they can also have other things going on with them that could be causing their pain or symptoms. Like, it's not mutually exclusive. Also, something that could make you feel really depressed and anxious is being diagnosed, especially young, with a lifelong condition that's going to cause you pain and affect your quality of life. And that can be depressing. Sorry, they're watching my window right outside.
No, it's fine.
So, you talked a little bit about dealing with depression in kind of your teen years. How did you deal with like your mental health and the other conditions that you're dealing with, in terms of like dealing with talking to your doctors about it, getting support? Was your mental health blamed for other things, or vice versa? Or did you feel like the fibromyalgia impacted your mental health as well? Like, how did all of that kind of interact together for you?
I feel like chicken and the egg is a really good way of putting that, because it's like, yeah, I feel like, obviously depression can and mental illness can come from so many different variables inside our, wacky brains and everything. But, obviously, yeah, I was dealing with the fact of like feeling like I'm going to have this illness forever, especially the longer it went on. And I realized, okay, this isn't a juvenile case. This isn't going away. Once 18, 19 rolled around, I was like, oh yeah, this is for real. So that was definitely difficult. And I feel like there's like this push and pull sometimes between what's best for your physical health and what's best for your mental health. There are so many times I'm like, my body is telling me I should really stay home and rest and, not do this thing. But my mental health is screaming at me to get out of the house and go talk to a friend and go get outside in nature. And so I feel like sometimes it's, it's worth it sometimes to do the thing that's going to improve my mental health that day versus doing the thing that might be best for my physical health that day. And back and forth, and which one needs to be prioritized the most, and how those things can both coexist for sure.
I relate to that so much. It almost feels like a ballet, like a delicate ballet of like, how do you balance both of the things? Because yeah, sometimes they need different things, and how do you know what to do at the same time? Kind of building off of that, something I've been thinking a lot about actually this week was, there's like the 5 stages of grief that they talk about when you lose someone. And I feel like there's grief that comes in when you get diagnosed with a chronic condition, because the life that you thought you were going to have is going to be different, and that there might be limitations, and then one thing like I dealt with this week, and I don't know if you've had ever a similar experience, was like, I thought I had gotten to the acceptance stage of the grief cycle. Like, I've been living with this for a long time. And I had something come up this week that all of a sudden I had grief about the chronic illness in a way that I was surprised by, because I thought I was past this type of thing, you know? Have you felt like you've gone through grief in terms of dealing with your condition? And has it felt, if so, has it felt like a linear process for you? Or does it feel like you kind of go back and forth between the different stages?
I feel like you just kind of hit the nail on the head for me. This is something I've been actually writing about a lot lately. And I I feel like there's a sixth stage of grief for chronic illness. I feel like it is more cyclical in a way, because there is that general acceptance, but there is that every once in a while something will trigger it and I go back to it, and revisit that place and revisit that feeling um of mourning, what could have been. And I think that, it's hard not to, obviously you don't want to live in that what if land, and so got to pull ourselves out of that. But I think that that's absolutely a natural thing to happen. And I think it's going to continue to happen throughout my life. And I think it doesn't make my acceptance any less real. I think I'm still fully accepting of my life and living with chronic illness. I think I've absolutely come to that point, but I think I can also still have moments of just sadness and what's the right word? Moments of contemplation and reflection of it shouldn't be this hard.
Yeah.
That's okay.
Yeah. Yeah. Something about it just like took me aback this week. I was like, man, this particular thing, I thought, even the doctor was like, you seem so accepting of this. And then later I was like, I'm really sad about it. And it kind of caught me off guard in that way. But I'm definitely going to check out what you've been writing about grief with chronic illness, because I think that's something that isn't talked about enough, type of thing. So you talked a little bit, going back to kind of your journey, you talked about going to the rheumatologist once you kind of hit adulthood, and kind of just being, not really given a lot of options. Is that where you still are now in your treatment journey, or how have things changed or not changed for you in terms of disease management?
So thankfully, no. After those kind of initial visits when I first turned 18 and, going on some of the, FDA approved medications for fibromyalgia and kind of ruling all those out that didn't work for me. I felt out of options for a while. And I also just felt like I was just kind of fed up with the kind of the same spiel of, not being able to do anything else for me, or, waiting until there's, more options on the market as far as pharmaceuticals. And so I think that, I got to a place where I got a lot better at managing my health and paying attention to it instead of running from it. I think for so long, I was just trying to ignore it and be as much a normal 20 something as possible. And I think it caught up to me. And I had a year where, I didn't have a flare for 6 months. And then I had a year where I flared for 3 months straight. And, it just, there seemed no rhyme or reason for so long. And then I was recently in 2020, the end of 2020, beginning of 2021, I got really, really sick. And I could tell that there was definitely something else at play in addition to my fibromyalgia. I was like, I've been managing this for 15 years now, nearly. I think I know what this feels like in my body. And so, went to the rheumatologist and was like, I think we need to look into something else. There's something else going on here. And I was just completely adamant about it. And I have a new care team that I've built over the last few years that I really do trust and really do seem to be on my side and have my best interest. And so we started, you know, going through some more stuff, and it turned out I had developed psoriatic arthritis as well. So that was not as much a big of a hit, I feel like, because I already knew I was chronically ill. So it was like, ah, what's one more? Come on, you know. But then you know, we were able to dive into some different treatment options, and relatively quickly, thankfully, within 6 months, we had a really good treatment plan nailed down for me that I was responding to. And so I've been on biologics and DMARDs for almost 2 years now. And I am in less pain than I've probably ever been in. It's incredible. I've also been able to seek out like other things that were going on underlying. I finally got treatment for my migraine. I finally, you know, saw a GI, and like, you know, just dealt with some of the other underlying issues that were kind of hiding underneath my fibromyalgia or with it, that I, you know, just kind of chalked up to all being a part of it, and started, you know, trying to say like, well, maybe there is other stuff at play here that I've just been, you know, grouping under this umbrella for way too long because the symptoms are so broad. So was able to get some second opinions, some extra diagnoses, and, you know, ultimately treatment. Went through about a year of physical therapy, and that was able to rekindle so much of the muscle that I lost during the initial time of having psoriatic arthritis untreated, and the damage that that was doing to my joints. So feel like I'm at a really good place now with kind of, you know, trying to ease that progression and, you know, really balance that with living an active lifestyle again. So it's kind of finally at a happy ending, I guess, to this story.
Yeah, that's amazing. I have not talked to a patient who has had only one condition. I feel like it might have happened over time, but sometimes I joke it's kind of like Pokemon cards and you got to catch them all because you feel like you're just like collecting
Yes,
them,
I think
right?
I have 6 now.
Yeah, I have something like that too. And it helps though knowing, because it helps open up different treatment options for you. But and tell me how you feel about this. It can be challenging because there can be such overlap in symptoms that it's hard to suss out sometimes the different, you know, conditions to know what is coming from what, or are they coming from multiple things? You know, fatigue could come from like 15 different conditions, you know, type of thing.
And when you're
Um,
already feeling so bad,
yeah.
like, how do you tell when something else is going on?
100%. And you're used to feeling bad. So it's almost like do you feel like you almost like what's the word? Like you paid less attention, or like you minimized other symptoms because you're like, well, I'm just used to feeling bad. So this is just probably like that you noticed it less almost or something because, or minimized it because you're used to feeling crappy.
Yeah, I think I had worked so hard at just ignoring how I felt, you know, and not checking in with my body and doing everything I could to not feel my pain over the last 15 years, that I think I was just so used to suppressing any of those signals, trying to reach my brain saying, hey, something's wrong, something's off here. It took me a week and a half before I realized I had scarlet fever, because I thought that I was just having a bit of a rough flare and just feeling a little cruddy. And then I, you know, finally went to the doctor, and they were like, oh my gosh, we have to put you on antibiotics immediately before you're hospitalized. Like, and then I was, you know, on bed rest for a month after that, fighting for my life.
Yeah.
Um,
Do you would you say it's accurate that there's almost like a stages like that you go through, almost like a roller coaster of sometimes there's really down periods of you're just like, I can't go to the doctor anymore, they're not gonna be able to help me, or like I just can't handle another doctor's appointment, so you actually like don't go for longer than you know what you should be going. And then there's other periods when it's like oh, we're trying to figure out this diagnosis, something's going on, and you feel like you're at the doctor every day type of thing, doing a test or something like that. Has that been your experience for you, or how is your kind of like your level of engagement with the health system? How has that been for you, like throughout your experience?
That's so real. These are great questions, by the way. I can tell this is coming from very firsthand experience. Um, but I mean, absolutely. I think that I'm blanking out right now. I think that the admin and medical burnout is completely real. I think that that's something uh when I've kind of figured out if I have an issue going on that I want to look into, I need to allow at least a year to just that one issue and that one specialist, because I'm going to be going through the testing and the, trial and error of different medications, and that process typically takes a year from that first visit, then a 3-month follow-up on that first medication you're trying. That doesn't work. The second one, so I feel like I try to only like I'll pursue one for a year, and then I need at least a year or two to recover before I can go back into that admin mode, and also to catch up with my life and my work and my finances. Getting diagnosed is expensive, and sometimes I just can't afford to go to the doctor any more than I already am. So things unfortunately, do get put off, or minimized. But I think that, yeah, that's ultimately the flow that I've found with it, as far as like when I have something that I think is wrong and want to look into. And yeah, at first it was like, I can't tell them I have all these issues. They won't even know where to start. Like they just like, we're like, okay, we're just going to focus on the fibromyalgia. It's like, okay, so we're just going to ignore my stomach and like the fact that I need to see a neurologist and cardiologist. And okay, I'm going to go to all these separate specialists. Cool. And so, yeah, working to get those referrals and then going to each one, it's an exhausting process, exhausting and expensive. So yeah, that's my rule of thumb. I probably get one every 3 years.
I mean, preach. And then that feeling when you go to the doctor and it's like, well, why haven't you been to the rheumatologist in like 2 years? It's like, because what's the point? Like, so what's the point? Sometimes you're like, for them to tell me there's nothing more we can do, like, or to make me start to do a bunch more of tests to end up in the same place. Like, I need to take a break. I don't know if you've ever been there, but I've been there. I've had periods where I just was like, I need a break, kind of.
Oh, I mean, I go every 3 months now. And at one point I didn't go for 8 years because I was so fed up and had had such a horrible last experience that it took me that long to work back up to it and convince myself like, okay, better doctors, better technology, better science, better, better education, better, public awareness.
100%.
So I think it's important to still have hope that things do change in the medical field too, and that it's advancing and it's only going to grow to help us. It's already come so far from, I mean, in 1980, fibromyalgia was in the DSM as a psychological disorder. So the fact that here we are, 2023, I am being taken seriously for all of these invisible illnesses. They are very, very credible in the medical field and heavily studied now. I'm at least happy for that. And and I love to see that continuing. I think there's such a focus now too on understanding chronic pain. I think especially with the opioid crisis in America, I think it's been really eye-opening about how many people are dealing with chronic pain, even beyond those that have diagnoses and people that, can't afford to go to the doctor and take it into their own hands to find pain relief. And I think that that's become a real focus in the medical field now. And hopefully we should see a lot more advancement.
Yeah, I hear you. I agree with you. I feel like there's the opioid epidemic, but there's also just like a chronic pain epidemic. I mean, even just us calculating, just we focus on like 20 conditions to start, right? Like certain autoimmune diseases, fibromyalgia, chronic fatigue syndrome, whatever. It's like 85 million people. That's like 1 in 4 Americans living with these invisible illnesses. That doesn't even cover like every autoimmune disease, everything. That's a lot of people. That's more than cancer and type 2 diabetes and chronic kidney disease combined, of the number of people living with invisible illness. That's just like still not really talked about or getting the same attention. And I think, hopefully now it's starting to get more. Even long COVID, I think, brought awareness to these types of conditions.
Absolutely. I completely agree. Even in my family alone, we have lupus, rheumatoid arthritis, psoriatic arthritis. I mean, the whole spectrum, Hashimoto's. I mean, it feels like everyone in my family has something going on. So yeah, I can't imagine if you extend that, to so many other families. And I think also just, people going to the doctor more for pain. I know like my grandparents' generation was not, trying to go get diagnosed for anything. So I think, we'll start to have, really eye-opening experiences about, what's going on within our family trees, soon.
Yeah. All right. 2 last questions for you, because I know we're getting close to being out of time. And thank you again. I'm really enjoying this conversation. One question is kind of, you talked about you have a care team you like now. It sounds like there's a lot of people in that care team, which makes sense because you're having multiple systems of your body affected. What types, like who makes up your care team? And then who is the quarterback of your care right now? Like what role does your primary care provider play? How do you get coordination between, or can you get that between your different specialists? What does that look like for you right now?
So I did make the choice to kind of see all of my care team is all kind of within the same hospital network. So they share all of the same records and internal systems. So I think that has made it a little bit easier for everything to be in one place for everyone. I have my nurse practitioner, I have my rheumatologist, my neurologist, my cardiologist. And I would say the rheumatologist is definitely my quarterback. They're like my go-to. And definitely like their nurse, like the doctor's nurse that I have that I can, message through the portal. They're like incredibly responsive to me. And I think that it took a long time to click in that I could go to a different doctor, that I could get a second opinion, that I could, fire them, that I could, move on and continue seeking, a doctor that I felt, respected and heard by, where I didn't feel like I was constantly being rushed out the room. And it was such a validating experience, like my first few appointments with these people, where I was just like crying tears of joy at like just how helpful and like compassionate the care was, because I hadn't experienced anything like that previously. So I highly, highly recommend, continuing to, look for someone that you feel respected and heard by, and not dismissed. I think that's the biggest thing, is, somebody that's going to attempt to get to the bottom of things, that truly cares, and doesn't want you in pain. I think that's ultimately it.
That's great advice. And this last question kind of builds off of that advice a little bit, but I feel like hindsight's always 2020. You've been living with these conditions for a long time now. Is there anything that you, like, if you were talking to someone who was earlier in their journey than you, and you were like, things I wish I had known when? I wish I had known this, 15 years ago, or even 10 years ago, or 5 years, last year, I wish I had known this. What are some things that you would tell them of like, if only I had known this then, that would have been really helpful for me in my journey?
I wish that I had known about the free care programs. my hospital and looked into those sooner. A fellow chronically ill person turned me onto it, and I realized that I qualified and was able to get an entire year of my hospital bills paid for. That was absolutely huge. That saved me like 70 grand. Um, I think that I would I would want to tell myself about patient advocates existing. I think that that's a huge thing that I never thought of. Even just if I'd asked a friend to go with me, I might have, felt like I could stand my ground more or advocate for myself. Definitely, in my early 20s, and teenage years, I was very meek, not assertive, and definitely going into, you know, those situations, I needed to be very strongly advocating for myself. And I wish that I had started to do that a little earlier and sooner, and felt like I could voice what was wrong with me. We do know our own bodies. We know what's going on. And I think just to trust that and to continue looking to work with someone that will find you answers.
I think I agree with all those things. That's really, really good advice. Well, thanks so much for chatting with me, for sharing your story. It's really powerful. I think so many people will relate to your experiences and find themselves in your stories. I'd love to stay in touch if that's something you'd be interested in. Um, and if there's anything I could do, like to, give you access to our platform or something like that, we have board certified patient advocates that we match with every patient, like, because I didn't know that that was an option either. Right. And being able to like help patients feel like it's not all on them to figure all this out, and they have support, how to navigate it. So if there's any way, if you ever feel like you want connected into that, I'm happy to do that too. But I just really appreciate your time today. Thank you so much.
Thank you. And thank you for what you're doing. This has been such an honor. And I felt so lost when I first got sick. And it's so dear to me to help anyone not feel like they're in that position.
Yeah, definitely. All right. Well, it was really nice chatting with you, Marissa. I hope you have a great rest of your day.
All right. I'll talk to you soon. Thank you so
Okay.
much.
Bye.
Bye.